Hi everybody, thank you for tuning into my channel. So I just got back from Bath and Body Works in Homedale, and I wanted to give a shout out to Susan for having a smile on her face despite the troubles in her life. Thank you so much for helping me with my purchase today, and I wish you continued strength and a speedy recovery for your husband. For those of you who don't know me, I'm Dr. Falguni Patel of Rejuvenate Center for Medical Aesthetics and Wellness in Aberdeen, New Jersey, and I'm here to talk to you about acne. So we've all suffered with acne at one point or another in our lives, and as you know, it tends to come upon us with the onset of puberty. I also see it very often around perimenopause, and of course during times when we are very stressed, which is probably the worst of it all. So a couple of things. What should we do? Number one, the biggest thing that's important in my opinion is a clean diet. Clean diet means avoid processed foods, avoid those excess sugars. What you ingest into your body can cause inflammation, which can affect your skin. So avoid foods that are of inflammatory types. The next big thing would be to consume water. Lots of water is needed, a lot of fluids. What this does is helps clear out the toxins from our body. Number three would be good hygiene. Stop touching your face, you don't know where it's been, what you've touched last, but you do bring bacteria to your face, so avoid touching your face. Keep your hands clean, keep your face clean. Next thing would be avoid excessive facial washes. Sometimes they can be very harsh and it can cause our skin to get very dry, and sometimes that dryness can also increase the chances of the bacteria causing more infections and more inflammation. So keep it very simple and avoid excess makeup or any makeup. I think you've heard me say this before, let your skin go naked. The skin does need a chance to breathe. I know it's hard, especially when you're young and you're going through puberty and you're having that acne, you want to cover it up. But every time you cover it up, you actually make it a lot worse. So avoid it if you can. So what to do in terms of treatment, or what are the goals? The goals are to kill the bacteria, to resurface the skin, and to control the hormones. So in my practice, patients tend to come in, and as you know, 70% of my patients are female patients. So for my female patients, my combination therapy is hormonal balance, so usually with a hormonal birth control pill. Attacking the skin to treat the bacteria, so that would be something like an antibiotic solution. Resurfacing the skin with something like a retinoid, and that would be pretty much it. That's my cocktail. Benzoyl peroxides are great, but you want to make sure that you don't do excessive amounts of it because it will dry up your skin. And so for those are the basics for most patients. For those that are doing that and are still looking for something a little bit more, we do offer the dermal infusions in our office. And what the dermal infusion does is it sort of sucks or cleans up the skin with a brush and like a microdermabrasion sort of thing. And then we infuse your skin with a proprietary acne regimen. Repeated treatments can also help the acne get under control. And then the last thing, for those that suffer with old scars, there's a couple of modalities. There's RF or radiofrequency treatments, laser treatments for resurfacing, and microneedling. Most of these treatments cause micro-injury, which allows for the collagen and elastin to build up. They do work, but patience is a big virtue. For those that don't believe me, I suffered with bad acne, and it was around age 19, about 25 plus years ago, when my dermatologist at Mount Sinai, New York, gave me my cocktail, and I've loved him ever since, and I hope to do the same for you. So I hope today's segment helped out a little bit, and if you're suffering, remember you're not the only one. Just take a deep breath and you'll get through it. Take care. Until next week.